de Oliveira is the director of the Centre for Epidemic Response and Innovation at Stellenbosch University. He joins us now from Cape Town in South Africa. Thank you so much for joining us, Tulio. Now, everybody says it's very difficult to get this particular disease, this virus anyway, but facts on this ship would seem to prove otherwise.
Yeah. Thank you for having me. Yeah. It is very difficult to get that disease. Yeah, especially when we call human-to-human transmission. Yeah, but what probably happened in the ship, is limited transmission. We don't expect all the passengers to be infected, and what you have to remember is that these passengers then spend over a month together in close proximity. Yeah. In a ship sailing through very cold areas, so a lot of time inside. So what we know is that this virus, it's only transmitted by very close contact. So we are not surprised that the first two infections that people end up dying were a husband and a wife, which the wife ended up unfortunately dying when she was here in South Africa.
Tulio, though, I mean, if you look at it, one German woman died a day after flying to the Netherlands, and a flight attendant admitted to hospital showing symptoms as well. So it's not just close proximity for a long period of time. That would have been very brief.
I think that you have to be careful at the moment to assume that the flight attendants that show symptoms, it is infected with the hantavirus, because a lot of the initial symptoms of hantavirus are common symptoms such as gastrointestinal symptoms, GI symptoms, or fever or headache. So I think that we should be a little bit cautious to assume that is hantavirus until the diagnostic results that are being done at the moment. We have reasons to understand that in the Netherlands, some of the most advanced teams on public health that are looking at that. So I think that we have to be careful to assume that that's a hantavirus before the final diagnosis.
Tulio, I mean, you're a global expert on this particular virus. How confident are you that this is not going to result in some kind of pandemic?
Okay, so this virus is not new. Yeah. It was discovered in 1976, 50 years ago. Yeah, it first spread quite widely in Asia and in Europe. Yeah, and then have entered Latin America and South America. Yeah, Argentina, the country that it is at the moment the epicenter, or that have the highest number of cases of hantavirus in South America, we are talking about 60 cases a year. Yeah, so, and most of them acquired direct from animals with very limited chains of infections. Yeah, so if this virus were to cause a pandemic, yeah, we would already see a large number of infections happening in Argentina and in other countries, but we don't see that. And all the biology, all the science that we know about the virus, hantavirus, and even that specific strain, the Andes virus, which it is transmission between humans, is limited.
The fact that we have different strains, Tulio, does show that this virus can morph, it can evolve. Does this worry you?
No, not at the moment, because the sequencing, what you call when you decode the DNA of the virus, which 3 of the samples have been sequenced, both 2 in South Africa and 1 in Switzerland, show the genome of the virus to be extremely similar to the Andes virus that's currently circulate in South America, talking like around 99% identical.
Tulio, thank you so much for joining us. Tulio de Oliveira, the Director of the Centre for Epidemic Response and Innovation at Stellenbosch University there in Cape Town. Thank you.